Tomorrow marks the annual observance of World Mental Health Day, aimed at raising awareness of mental health issues faced by people around the globe. This year's commemoration comes amid challenges faced by so many as a result of the COVID-19 pandemic. Joining me now on Skype is Dr. Suzanne Nortier Hollman, clinical psychologist and director of clinical operations at Georgetown University Counseling and Psychiatric Services. Dr. Hollman, welcome back. So good to talk to you. The COVID-19 pandemic has highlighted public health in an unprecedented way. Can you talk about the ways the pandemic has impacted mental health, be it due to the isolation caused by lockdowns and restrictions, or maybe fear and anxiety about the virus in general?
I think, Tracy, it's not a secret that we've seen an incredible uptick in the needs for mental health help from people sometimes who've never needed mental health assistance before. And we're getting calls, I'm getting calls in my private practice from people who've never spoken to a therapist before. So I think a lot of us are getting in touch, maybe many times for the very first time, with needing help.
Doctor, in your opinion, do you think enough attention is actually being paid to supporting mental health initiatives and treatments now?
You know, I don't think so. We're having a real issue just generally finding enough therapists who are available. Many therapists are full. And I also think that money is an issue. There's many people who need low-fee therapy, and sometimes there's long waits for those. On the plus side, there's a real awareness, I think, in the part of the mental health community that we need more services. And many therapists are opening up low-fee slots in order to help those who need it the most. But there is definitely a little bit of a supply and demand issue right now, I think certainly in the DC area in my experience.
What about those with substance use disorders? How have they been affected, and have we seen an increase in uses and overdoses during this time?
We absolutely have seen an increase. There's many different studies out there, some by the CDC, some by some other research organizations, that puts it anywhere between 16 and 29% jumps. So I think during this time, some people are reverting to substances as a form to cope with stress, and some people are starting to use substances for the very first time. And both of those coping mechanisms are not good long-term strategies, as we know, because they're very addictive.
Absolutely. I want to talk about our young people right now. How do you think the pandemic is impacting their mental health, especially since for so many of them, they're attending school again virtually and have limited in-person interaction with either their classmates and their teachers?
I think that's been very interesting. And what we're seeing is that if you think of it from a developmental perspective, a lot of these young people are not really supposed to be home, if you know what I mean. Lots of them had big plans for going to college. They've spent a lot of time thinking about where they'll go to college, along with their parents and families perhaps, and they are at home. Or they were at college quite happily, and then they had to go back home. So I think developmentally young people at that age really wanted to leave home in many instances, and as much as they love you, they might not necessarily be planning on living with you again so soon. So there's a lot of disappointment and a lot of frustration on behalf of some of the young people that they're dealing with, compounded with a work format that's all virtual and all online that some people are finding quite tiring. And they're not having the social stimulation to help cope with that. It has been a big adjustment for a lot of young people. A lot of them are doing well, though, I think. In general, but I don't think this is quite what anyone had in mind for this whole thing.
Well, Doctor, thank you so much for spending time with us today and talking about this very important subject. We appreciate it. Dr. Suzanne Nortier Hollman, thank you again.
Thank you. Good evening.